Um, Welcome everyone. We're having our second mental health webinar. The topic for today's webinar is psychological aid for our medical frontline healthcare workers. Joining us today on our panel is Dr. Stephen Weine, who's the Director for Global Medicine and the Director for Center for Global Health, Professor of Psychiatry from the University of Illinois College of Medicine. Also joining us today is Erin Tobin, a Supervisor for Behavioral Health and Social Work at the University of Illinois in Chicago. Um, uh, Thank you both for joining us today. If we, I would like to hand over the floor to Dr. Weine for the first part of this session.
Thank you, Miriam. Thank you for taking time out of your busy schedule to be here with us today. The topic today is psychological first aid, which we think is a very helpful strategy for supporting healthcare workers. Healthcare workers are on the front lines and exposed to a lot of stress and a lot of challenges, even more so than usual. So we want to help to give you some skills and knowledge that you can use very practically in your daily work. So, we recorded a video and we gave some materials. Have people been already exposed to those things?
Yes, the team watched the videos. The written material was a bit long, so the team could not go over it fully, but they did try to go over it in summary.
Okay. Maybe the best. So, Erin and I would maybe like to do discussion Q&A, based on what questions or issues people have. And then we also thought we could do some actual role playing with people here. Though I guess that depends a little bit on the language issue, but why don't we start with Q&A and discussion and then go from there? So is that okay, Miriam?
Yep, that sounds great.
So what does anybody have any questions about the video or the material that they would like further discussion on or explanation on?
I'm just waiting for the questions to come in. So there is just a little bit of a time lag because of the internet, but the questions are coming in.
The internet's working in the camp?
The internet, there has been discussion about relaxing the restrictions on internet in camp, but it has not been fully relaxed yet, so it's still patchy, available but patchy.
If you don't have any, we could just start talking.
Yeah, perhaps we can get started with the role plays, and then as the questions come in, we can do the Q&A afterwards.
Okay. So, and is this being simultaneously translated for people?
No, there's no translation happening right now.
So people understand in English?
Yes.
Okay. So, Well, one way to do this, Miriam, is you've heard. What are you hearing about the kinds of issues, stresses, challenges, pressures that healthcare workers are facing? Um, are there some typical stories that you're hearing?
Yeah, so some of the main concerns is anxiety related to a lack of access to personal protective equipment. So, oftentimes, linking with the lack of PPE, a lot of our team members and healthcare providers will often express concern about how anxious they're feeling, um, and also anxiety about transmitting this. Uh, Getting the infection and then transmitting it to their family members. So that's one of the most common uh, sources of anxiety, and also like most common complaint would be anxiety related to that.
Mhm. So we dealt with that in the in the role play that we did.
Mhm.
Um, I wonder if you or others who saw that thought that that was something they could do. Could you provide the kind of support that Erin provided for me in that role play? I was concerned about infection. I was concerned about giving it to my family. My family was worried. Erin helped me with that. Is that something that you think you could do for healthcare workers there in the camp?
Yes, yes, I believe we can definitely try to exercise that. Um, Dr. Rahana or Dr. Sanzida, if you would like to speak, you can unmute yourself and provide your thoughts. Okay, so Dr. Rahana says that one of the issues they face when it comes to providing psychological first aid is that um, uh, is that even after counseling each other and telling each other to stay engaged with other activities, there's the fear of corona, which a lot of times they're not, they're not able to like really internalize the fact that they are not infected with corona. So in that case, so even after the first aid that they provide, is there any other recommendations for the healthcare providers to um, or any actions they can do with each other?
Mhm. Um, well, I think it's a good point. So you're saying that after one session, one interaction of psychological first aid, the person is still feeling those fears. I
Mhm.
would completely expect that. Um, and I think that the fears are not going to be, the threat is present, it's present all the time. And we're all living with that, and health workers are living with that even more. Um, so we can't make that go away. We have to be honest about that. And I think that a person's fears, it's totally normal to have fears. Um, um, the issue is, can you I maybe um, diminish it somewhat over time, and can you learn to live with it? Not can you make it go away, because it's not going to go away. Um, what do you think, Erin? You're muted, Erin. You're muted. Can you unmute Erin?
Should be good now.
Okay.
Yeah.
Good morning. Yeah, I would agree with Dr. Weine. The reality is that these anxieties are real, and the situation is not going to change, right? So I think it's important to stress to your colleagues more about how to manage that, how to live with it, and be able to still do their job and look after their family, because you can't take away, you can't assure them that they're not going to get infected, or that they're not going to transmit this to their family, because it's possible they will, and they're not properly protected, right? um, you can like, kind of like we did in the role play, you can remind them that they do have certain protections, and that some, whatever is in their control, like, they can focus on that. Well, do you have something that you can, what protection are you looking for? Is there any way you can make that yourself, or might you be able to find this somewhere? But after that, right, it's not the, unfortunately, this is not about taking it away, because we can't do that. And so we have to coach them on how can you manage this panic, or this anxiety right now, and also continue to manage it, like, going forward. How can you take care of yourself, and also still be able to do the things that you want to do, like, remind them, you guys want to keep working, right? And if they want to keep working, yes. So how can we manage these worries so that you can still take care of your patients? Does that
Another,
make sense?
I would I would add to that. I agree with everything Erin said. I would just like to add some strategies that we use. I mean,
Mhm.
we say to people, we're we can't make this go away, but we can increase your confidence and competence that you can manage this. You know, this is the new normal going forward, and you can manage this just like you've learned to manage and live with other challenges in your life.
Right.
Um, and so, what would success look like? Think success would look like if you felt 20% better or 30% better. And so sometimes we'll ask people to rate your fears right now. Rate what you're feeling in your body. And they might say, well, out of a 10, I'm feeling like it's a 7 now, or 7 or an 8. Like, okay, let's do a breathing exercise. And let's see if we could bring 7 or 8 down to 5. Um, and then you show them that they're able to do that, that they're able to decrease, and that helps to build their confidence. And said, okay, when you're out there in the clinic or you're at home and you're feeling stressed out, let's try to reduce it by 2 points. Let's see if we can do that. And
And
that
that will,
way you build their confidence, and that's what it's all about.
and it gives them a sense that they do have some control. It's really uncomfortable and scary when we feel things are completely out of control, but just by showing them that they have a little control over their anxiety will make a difference.
Summarize what you said. Basically, whenever one of our staff is feeling extremely anxious and are expressing behavior that is really scared, then we ask them, uh, I know you're feeling scared. On a scale of 1 to 10, how scared are you? And if they say, 8, I'm really, really scared, then we go through one of the techniques that we learned in the previous webinar, as well as in the videos. And as long as, suppose, for example, we do the breathing technique, and after doing the breathing technique, um, we ask them again, how scared are you right now? And they say we're at 5. That means we have helped them get a control over their anxiety.
Mhm.
It means
That,
they've helped themselves.
Yeah.
They've helped themselves. That's what's most important.
Mhm.
You were just pointing out something they can do, but it's all about what they can do.
Mhm.
so I guess the take home message for all of our providers, then everyone on our team, our doctors, medical assistant, and nurse, is that you really are in control of your own anxiety and the fear you are feeling whenever you think about going outside of your house, whenever you think about going and meeting patients. You are in control. The infection may happen, but you can always control how much fear you feel. um,
Mhm.
I've summarized that correctly.
Well, I think you're maybe putting a little too much emphasis on how much they can control. I think because you can't control the situation outside of you. You can't you can't control the vulnerability to infection, but I think that um, you can control your emotions to an extent, not completely, but to an extent. Enough that will make a difference. Enough that will enable you to do your job, to sleep at night, to spend quality time with your family.
Yeah, I guess that's another learning point for us as well, to not be overly optimistic when we do provide psychological first aid.
And
That
it's important to stress their strengths. You know, you're asking for help. That's a positive thing. Um, you know, remind them, like Dr. Weine said before, what they've managed their way through before. You know, the things that they've made it through before. Um, just like very supportive and stressing how strong they are. You know, that does that make sense?
Miriam, the I don't I agree with what Erin's saying there. Um, don't Psychological first aid is more than just teaching people stress reduction techniques. Stress reduction techniques is, I'd say, one of 4 things you're doing in psychological first aid. So let's say what those are again. One, first and foremost, you're listening. You're just listening to the person. You're helping them to feel less alone. Okay? Um, the second is you are helping to diminish their emotional distress by giving them tools of deep breathing and other stress reduction techniques. So that's what you were doing before. The third is you're you're shining a light on their positive coping strategies, on their strengths, what Erin just said. Okay. And the fourth is you're connecting them with existing social supports and resources. So you're trying to do all of those things
Mhm.
in the span of 15 to 30 minutes.
Thank you, Dr. Wayne. One of the scenarios that one of our team members just shared is they stay busy the whole day in clinic working and they feel fine. Once they go home, they suddenly start experiencing symptoms that they feel is similar to infection, like shortness of breath, having a sore throat. The following day, during working hours, they feel fine again. So, is any advice on dealing with a situation like this when they experience it themselves or one of the colleagues are experiencing something like this?
Erin, you want to take that?
Um, I, I would I would respond, so if this was a patient of yours and they told you, that they were fine all day, then they went home, they had a sore throat, they had shortness of breath after um a lot of stress at work, and then they went back to work and they were okay again. And then they went home, they had time to think, they started feeling these symptoms again. What might you say to your patient? What, as a physician or as a nurse, um, what might you how might you respond to your patient? So you're giving them, like, you're putting it back, you're giving them control to think about the situation, to to hear what it is that they just told you. um and so then I would listen to what their answer to that one might be. um does that help?
Yes, that helps quite a lot.
What would they say? But let's ask Miriam.
Yeah,
What do you think they would say? What would a nurse or physician say?
Mhm. So, usually we would point out to the patient about how well they're performing during the day. So, how their daily life and their daily activities are not restricted in any way in this kind of situation. And getting the patient to focus on that first, and then slowly bringing them to the realization that the symptoms that they think that they're feeling at night or when they're not working might not actually be manifesting a manifestation of the illness as much as how much they're worried about getting the illness. Also, with patients specifically, we would always provide them with reminders of if it is continuing, if the symptoms do continue, to seek help as well, to go to a facility, get tested, or get treatment if it is not resolving. But if they find themselves feeling completely different during the day versus during the night, then it is so just getting them to sort of think about it, like refocusing them on their ability to cope and work during the daytime.
That sounds good.
Mm-hmm.
I would add to it this. If I was, let's say I was talking to you, Miriam, and you were this nurse or doctor who had this worry. Say, well, like, it's important that we take your temperature. Like, have you been checking your temperature? Because the fact is, all of us are at risk, and me too, and we should be monitoring our temperature if we think there's something wrong. So, are you doing that? Are you checking your temperature? And what are you finding?
Mhm. Yeah, the temperature is always normal. I don't.
Okay. Well, if it wasn't, that's good you're checking your temperature. So you're doing the right things to monitor yourself for symptoms. And I know that if your temperature is high, you know who to call, you know what to do, right?
Mhm.
You would seek help, you would separate yourself from your family. But if you're checking every day and your temperature is not high, then you're okay. And you don't have COVID and you're not infectious. So the real question then is, why are you having these extra worries at night? Um, and what could you be doing to either prevent those from coming or for managing those when they come? What do you think you need help with that, Miriam?
Um, so yeah, I think I guess one of the difficult things for us to convey is the you know like what else they could be doing. So the last part of that conversation, for example, is redirecting them towards thinking about why they're feeling those symptoms at night and what else they could be doing to occupy themselves during that period so that they don't think about like they
Are
um,
you? I would want to talk. What are you doing in the evening? Are you spending nice time with your family? Are you cooking dinner? Are you, you know, reading a book? Are you praying? Are you exercising? And I would encourage them. I would have an activity plan for every night. My concern is, and I would ask you, like, are you just sitting home kind of worrying about things? What's the first thing you do when you get home? What are the things that you have to do every evening? You know, what are the things that could give you pleasure? Um, and I would help them come up with an action plan. What do you like to do the most when you're at home? What what makes you feel good? Can you do that every night? Can you do that even more than you were doing before? And I would also teach them those exercises and practice those exercises. I would also maybe make the analogy, this what you're describing happens all the time to athletes, to police officers, to soldiers. When they're in the battle, they're fine. They're dealing with all kinds of stress and they're functioning at a really high level. And then when they're off the playing field, when they're out of work, they let their guard down, and then all of those intense feelings wash over them. And so this is a perfectly normal experience. It's maybe not normal for healthcare workers, because healthcare workers, we're not used to being under such intense conditions as soldiers or police or professional athletes. But that's the situation we're in now. And the way that those people deal with it is that um, they have special strategies for calming themselves down, for reinserting themselves into normal life. And you need to build up those strategies too. So that's the kind of way I would talk to people.
That's really, really helpful. Yeah, that's like normalizing it. And then, yes, that's very helpful as a counseling technique for us. I definitely appreciate that. One of our doctors has shared a scenario. I think she's talking about patient care in this case, but for example, if someone comes to one of our physicians and says that whenever they touch an object, they fear that the object contains the virus, and therefore they're finding themselves frequently washing their hands and again getting anxious about touching different objects in and around themselves. Again, it always goes back to anxiety, but in this case, is there any special sort of way to counsel them so that they would be less afraid of their environment?
Are they talking about at home or at work or in
Uh,
public?
I get scared.
That
At home.
everywhere?
At
At
home.
home.
At home. Yes.
Hmm.
Hmm.
Who lives at home? Like with her family? I mean, I suppose so.
Yeah. Full family.
I think the fact is that in the world that we live in right now, it's appropriate to have those concerns in the public or at workplace, and we wash our hands frequently. Um, I don't know. My daughter tells me she washes her hands 20 or 30 times a day, um, and and you should wash your hands if you're in the public very frequently or after you have any kind of contact. But at home, um, I think those things could be relaxed, as long as there's not people coming in and around your home, or you're not touching objects that have been in the public. Like if you bring back something from a store, then you should not have that. Like if it was wrapped in something, the wrapper should go outside, right? And you should not be having that circulating around the house. So, but if you're just talking about household objects, then I think it sounds like the person's worry or about touching something is needs to be decreased, needs to be shut down, needs to be lessened. I think that's hard because when your guard is up all day, It's hard to turn it off when you go inside. But I think that I guess this is like kind of like negative, persistent thoughts. And so, how do you stop having negative, persistent thoughts? Like, what is the idea? Okay, I'll say it this way. What is, before you wash your hands, what idea comes into your head? What are you saying to yourself?
Again, and you could ask the caller, like, is it distressing you that you're washing your hands so much? You know, it if it's not distressing them, but if it is distressing them, then yeah, you could get to. So if it's not
Right.
helping you to wash your hands so much, what is it we can do to to uh, feel better about that, or just to not wash your hands so much when you're at home?
That's a
Um,
very good point.
you know, if she feels safe and more comfortable washing her hands a lot, that's okay. Then you can remind her that's okay. You know, if that's not helping her feel any better, and she doesn't think that it's necessary, then you could, walk her through that. Well, tell us, and why do you think you need to wash your hands so much, and is there something you could do instead to make you feel better when you're at home, to make you feel safe when you're at home? You could talk about, like Dr. Weine was saying, like distraction techniques. Okay, so are there things at home that could keep your mind up, off of this for even 5 minutes? Just as realistic as possible, too. You don't want to say, can you distract yourself for 2 hours? Because somebody probably can't do that right now. That's okay. But when you have the urge to wash your hands, is there something you can do instead?
Thank you so much. One of the things that I have found when talking with a lot of my colleagues who are working the COVID response is that they will talk about a cycle of fear. So, not just a fear of getting infected themselves, but then transmitting it onto their family. So, for which they are self isolating and keeping themselves away from their family, feeling a sense of isolation within themselves, and then their thoughts cycling on to their own illness, and watching their own peers, getting an infection, perhaps getting a moderate to severe infection, and then thinking about their own end of life care. And it's just a circle of thoughts that are progressively more and more frightening to them. So, any advice for us when we face similar thoughts uh, uh, of that nature, or like how, or rather, what I'm asking is, how can we break the cycle?
Erin, you have
Um, yeah, I mean, so one thing I would start with is, like, that sounds really painful and hard, because they're human beings, so it's natural that that's where their mind is going right now. But they're calling you because it doesn't feel good, and they want help. So again, you can you can stress in the beginning, gosh, that sounds so horrible, I'm so sorry, that must be so scary. And I imagine that you're not the only healthcare worker that's having those kinds of thoughts right now. So they know they're not alone, and they know that you understand how painful this all is and how scary it is. And then move on to, okay, so, but you're calling me because it sounds like you there's something you think you can do about this. You wouldn't be calling um, if you were just okay to live with it right now. You're asking me for help, right? And if that's the answer is yes. Okay, so you tell me what, um, in the past, have you ever had thoughts that spiraled like this? Have you ever done something that you found was helpful to manage them, or like to get them back into under control? If they have an answer for that, great, walk them through that. If they don't, you can say, would it be helpful for me to guide you through some exercises? A lot of people have these kinds of cycles of negative thoughts, and many people right now are having these kinds of cycles, and we know that exercises like this will help pass that moment. The author, the focus here is like the moment, right? Because we can't tell them that they're going to be healthy even tonight, but we can get them, they're calling you for help now, or they're stopping you for help now. And so you can do that for them then. And then, like we were kind of saying earlier in the conversation, this will give them they will have demonstrated to themselves that they can control for a little in these moments. And so maybe the next time they start to, these cycle of negative thoughts starts, they'll think, oh wait, I know an exercise that worked for this before, I'll try it. So you can also like walk them through the exercise, the breathing exercise, or all the different techniques that are helpful in these moments. Does that help?
That yeah, that helps quite a lot.
There's a number of different, thought stopping techniques that could be taught to people really quickly. I think Erin was hitting on some of those. Um, here are some ideas. One is as simple as persons have like a reminder for themselves, like they know, like stop. They like say to themselves, stop. Just stop this, and and try to interrupt that change of thought. Another is they have like reassuring things they can say to themselves. Oh, I know, I know that, or they're more like reality check things. Like, I know that I'm a person who worries a lot. A lot of people are worrying in this situation. Um, the reality is that I don't have it. Most people don't have it. Chances are I'm not going to get it. And you write out a script to say to yourself when that happens. The other is, like think of a peaceful place. Picture yourself lying on the beach. Picture yourself out in the woods. Picture yourself, or sing yourself a song, your favorite song, or practice deep breathing or meditation. So there are, 6 or 7 different strategies that you can use. Hi there, how you doing? And you can figure out what works best for you. Another is counting. You count down from 30 to 1 when you start to have that. And so all of these things you could teach people, and they're useful.
Is really, really helpful. We have one question from the team member. If either of you could elaborate a little bit on sleep hygiene.
So these are, one thing I think about this is that you guys are healthcare providers, so you know sleep hygiene, and so and that's okay that you may not have it right now, because a lot of people don't, but they just need to be reminded that they know what good sleep hygiene is. You can say, what do you know about, what is healthy sleeping? What do you, when your sleep is good before, why was it good? What did you do before you went to bed each night? Like, were you on the internet, or were you in a dark room that was quiet? Remind them that they know what is good sleep hygiene, and because they're healthcare providers, and then also, maybe these are people that have had good sleep hygiene in the past. So again, you remind them that these are things that they know. It's okay that they haven't been able to put them to use, and now you are here to remind them that they know this and that they can practice it tonight.
Last
You're muted,
part
Miriam. Okay.
the
There you go.
webinar. If I could ask you to share your final thoughts or advice for our team members.
Mhm. Um, hmm. Well, I think that the skills that Erin and I have tried to teach you are really good skills that will make a difference for people. But like Erin said, um, what we're really trying to do is increase the sense of competency and control and mastery that people feel. And so um, it's just really important to point out all the things that they're doing right, all the strengths that they have. You're kind of reminding them of things that they know about themselves, but they've forgotten in the heat of this moment. So I would emphasize that, and I would emphasize listening, the importance of just listening,
Mm-hmm.
because especially healthcare providers, we spend so much time taking care of other people's needs. We often don't give enough space to express our own needs and concerns. And so giving a person that space is really valuable. And lastly, I'd like to say that, I mean, what I would really like to hear about from you all, maybe the next time we chat, is what do you find is working? How are you, what do you find that's working for yourself in coping with the stress that you're under? And what are you find is working in terms of how are you able to support your colleagues and support one another? So uh, I'm sure that you're learning all kinds of things about yourselves and discovering that you're stronger than you might have imagined. And I would like to hear stories about those kinds of things. So take notes, remember those things, and share them the next time we talk.
Amazing words, Dr. Weine. Thank you so much. Erin, any last comments for us?
Yeah, I would just support, just remind these people that, yeah, like Dr. Weine said, they have these strengths, and this all feels really hard and terrible and scary, and in reaching out, they're already taking care of themselves. They're already doing what they need to do to make these hard moments pass.
Thank you. I would like to thank all of the attendants as well as our panelists for joining today. And you're all doing amazing work in your respective areas, out in the field, at home. Um, and so, a thank you to everybody for the work that you're doing, but also just a reminder that we are here to support you as much as we can and to the best of our abilities as well. So, thank you all for your time. Have a good day and a good night to you all.
Thank you.